detail.
Let's call our Mason County Board of Health regular meeting to order, please. The first item on the agenda is to approve the agenda and add 2 resolutions to the agenda today. The first one, I think you received an email, 0118. That's the one of supporting rural health.
Yeah. Here it comes.
Have you had an opportunity to see that?
Joan did one.
The question. The question.
Yeah. Is it at all?
Yeah, tell me.
Is that
Did you
another
get
one?
it?
I have one of them.
No, I
I
didn't
have this.
look.
I do have this one.
I think,
Yeah.
what is
Is
this,
this
I
the
want
one?
to go back to
For the second one?
No,
No, okay.
the Foundation of Public Health.
Gary, how about you? You got a copy?
Got one.
Okay, all right.
And then the second one is,
This is the dates for next year's meeting.
Oh.
yes.
Yep.
Mr. Chair.
This one's hot off the press. You probably
Yeah,
got
this
that.
is like our last meeting for this year.
That's true.
Mr. Chair, I move that we add 2 action items to today's agenda after item number 3, or to today's agenda. One, the resolution supporting Foundational Public Health Services. And the second, a resolution number 0218, setting the 2019. Are these the 2019 meeting?
Oh, you know
Yes.
what?
Yes.
Except
2019.
for,
Oh, yeah.
all these should say 19.
Right.
Okay. Second. Thank you. All in favor?
Aye.
Motion's carried. So let's go ahead and just get those acted on at this point in time, since they're at the top of the agenda. If you'd had an opportunity to look at resolution number 19 rather, 0119.
No, this is
No,
the one.
18, because
That
this
one's
is
18.
still,
Yeah.
This
is-
one's 19.
No, that's still 18,
They'll
because
both
this
be 18.
this
It's
is
the dates.
year, the 2018,
Got it.
but it's for 2019.
Okay, I'm with you now, slowly but surely. Is there a motion to approve resolution 0118?
So moved.
Thank
Second
you.
it.
All in favor of approving the resolution, signify by saying aye.
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 Moving on to the next resolution, 0218, setting the dates for our 2019 meetings. Is there a motion to approve that resolution?
So moved.
Thank you, Peggy. Second?
Second.
Thank you. All in favor of approving resolution 0218, signify by saying aye.
Aye.
Motion's carried. We'll pass those around and give it back to Melissa here.
I'm reprinting 0218 with the correct 2019 year.
Just a point, your November meeting is 2 days before Thanksgiving.
Which is so,
Just
it's a Tuesday.
It's
saying.
doable.
Yes.
Thanksgiving's late.
No, it was early this year.
Yeah. That is correct. Yeah. Depends on how you want to look at it.
So do we still need to approve the agenda though? Or did we?
I'm still signing it.
Yeah, I thought the first motion was the approval of the addition on
Oh,
the
yeah,
agenda.
yeah, that was, I don't know if we actually voted, but.
Yes, we did.
Okay.
Okay, thank you, Peggy, for keeping me honest here. Have you had an opportunity to look at the minutes from our last meeting of September 25th, 2018?
I make a motion, we approve the minutes as presented.
Thank you. Is there a motion to approve the minutes of our September 25th, 2018 meeting?
No,
I'll second.
this is the one that
Thank you.
she's reprinting.
Yes,
But not the minutes.
she
I'm
reprinted
gonna
all
sign
the
that,
new
yeah.
dates
Okay.
to say 19.
Okay.
That's what I was looking at. This,
Okay.
This
no,
one's
this
good.
one's correct.
This one's good.
And Commissioner Drexler seconded the motion.
Thank you. All in favor?
Aye.
Motion's carried. Health Officer Report.
My report is that I'm sure you've seen my letter. I am resigning as of the end of May. on giving Kevin a full 6 months of my service before I retire. And this time I'm really retiring, so.
So, yeah.
Mhm.
So we can't talk you out of it, is that what I'm hearing?
You know, it's negotiable plus or minus. I think it depends on where, I think it's a good time. It's a good time for me. It's a good time. I just like climbed onto my Medicare bandwagon. It's a good time finishing up the opioid initiative. There's always room. There's so much that we do here in Mason County, and it's a very forward-thinking little town. And I think that there's a lot of things that can be done, and I think it would be a benefit to the community to get some new blood in, to try new things, new initiatives, and hopefully we have one candidate
You like that
that's expressed some interest, is going to meet with Dave, and as soon as you decide what you want, because there are a lot of different options for how you want to go into the future. In the past, you've had a local practicing physician, who served as the health officer. And then you've also had professional health officers prior to Dr. Truxas. That was here before. Dr. Hoover was here. And then you've had me. So you could go back and forth. And I think it's a matter for the board to decide which way you want to go into the future, how many hours. There's also been talk about regionalization, regional health officers. But in order to do that, you pretty much have to have all the health jurisdictions in our region agreeing on it, and I don't think there is consensus yet. So I think it's up for more discussion for you. The requirements are that the physician be licensed in the state of Washington and have a master's in public health. Without the master's in public health, they can be appointed as a provisional health officer. But having the public health background, I think, is really, really important, because it's not just straight medicine. I mean, you can be a great doctor, good doctor taking care of patients, but in public health, the patient is your whole community, and you have to put on a different hat, change your way of thinking, because when you're treating one patient, what may be good for that one patient may not be good for the rest of the community. And so there are a lot of other issues. We've got an excellent staff here in environmental health and in personal health. You've got we're doing less nursing, traditional public health nursing, but a lot more of the work with the community that is so important. So I think it's a good time, and I will, once you decide which way you want to go, I'm very happy to help recruit and talk to people, vet folks out, see, give them a reality check. Because there are definitely differences in health jurisdictions. And Mason County is small, and we have a lot of the same headaches in terms of dealing, but most of that we can punt to the administrator. But in terms of a lot of communicable disease control, we do have that, and it comes in little bits. Sometimes it hits us hard, and sometimes not at all. So it's like feast or famine kind of thing. But there's have always been a lot of concerns in the community. The one thing that I regret not being able to do anything about is our cancer rates. you know, because it's one of those issues that it's the accumulation of lifetime exposures to everything that raises our cancer rates. So, in our highest numbers, it's really, when you drill down to it, it still comes down to smoking and the use of tobacco. Is one of the highest risks that Mason County residents, and air quality as well, because the lung cancer rates are a lot higher than the rest of the state. But it's a tough one. It's a tough one to tackle. But we've tackled a lot of other little things. And we've done really good work on the environment. And continue to work on that. So I don't think you'll have a problem finding somebody to come and take over Little Mason with thumbs up.
Dave, will you be bringing back a job description for us to
So-
look at, or
so-
what's the process?
So the process is kind of however we wanted to go forward with it. I'll come back in January with a job description.
Okay.
But we'll need to talk about, do we want to hire locally? Do we want to contract with another health officer from another county? For example, Alan Melnick contracts with, I think, 3 counties now. He's also doing it now for Skamania, so.
No, there's a new health officer for Skamania.
Okay.
Yeah, we just
Um,
met her
Oh, okay.
last month.
And there's a new one up in Jefferson, so.
Yes.
Jefferson has a new health officer, so there's some things I need to explore with the health officers association.
Yeah, the other option is to even approach, say, Dr. Turner up in Kitsap. You know, because we do a lot of stuff. The north end gravitates towards Kitsap, and whether or not, you know, she's a full-time health officer, if that's something that you want to do. There are pluses and minuses to a health officer covering a lot of different counties. It definitely can be done. I did it for 25 years, so it can be done. The only time it doesn't work very well is when there's a statewide emergency and you're needed everywhere, and you can't be in all the places at once. But yeah, there's a number of health officers that are full-time that might be willing to take on another county. And there are very part-time. There's also Dr. Edstam in Pacific County is retiring as well. So there's a potential for a health officer to do both. So lots of different options.
So through December, early January, I'll be pulling some options together.
Good,
Then we can explore that at the
Okay.
January meeting.
great, good, look forward to it, thanks.
I mean,
Dave.
we've already started having these discussions with the Health Officers Association. DOH has been having this discussion, and in part of this ask for the $296 million through Foundation of Public Health, one of the things they talked about was level of communicable disease response available. And we pushed back pretty hard last week because they're making it kind of an arbitrary assignment that if you have this much population, that your health department can only handle these kinds of diseases, completely discounting the capabilities of the health officer and the people who are already there. So to say that Mason can't handle tuberculosis is incorrect just because of our size. So there's some clarification. There's a lot of movement at the health officer level, plus the funding piece. So it's a very fluid thing happening right now. So
Yeah. Thanks, Dave, we'll look forward to that. Anything else?
Just make sure that you got your flu shots.
did you want to talk about opioids at all?
Just in reference, in terms of numbers, or what?
Well, we haven't had any opioid deaths this year. So opioids look pretty good.
Reported.
Reported, okay, reported.
Yes.
Yeah, we have not had opioid overdose deaths.
Right.
Yes, that is correct. We continue to have overdose reports, and we had another recent one. So, as you know, about a year and a half ago, we made overdose reportable, and it's been working pretty well. So we're getting reports from the hospitals, the EMS, the fire districts, and also now from the north end, from Harrison. So we're getting the reports. Now, these are only folks who are encountering the healthcare system. So people still overdose in their homes, and we are also passing out hundreds of naloxone kits, the rescue drugs, so people are using them. So we get indirect reports that way. At some point, when we started doing the overdose reports, it was because we really did not have an idea how many people were overdosing in Mason County, how many people were actually using drugs, and we still don't know that denominator. But we know based on the number of kits that we've gotten out, how many people are interested. We now have a syringe exchange, part of our, substance use mobile outreach that's been going out. So we have a better interaction with our community that uses injection drugs and other drugs. So we are getting a better picture of the whole. There's still a number of grants that we're working on, and I think Lydia is probably going to be talking about that. And there's a lot of movement in that direction. So, we got quite ahead of the ball game on that, and I think this community has been just great. Just the last 2 weeks ago, we had our community meeting, and another packed room full of enthusiastic people that are working on a number of different aspects of responding to the opioid crisis. So we're going to make a dent. And that's great.
Thank you. Okay, Dave, back to you.
Okay. Well, the last couple months have been extremely busy. We had the Washington State Public Health Association conference. I spoke at that in a panel talking about accountable communities of health. And it was a pretty blunt panel. We got to, we did our own presentations, and then we asked each other questions across. So it was an interesting panel. And I was the only public health person on the panel, so we had insurance company and then two of the major ACHs, Better Health Together, and I think Host Clark. I forget who the other panelist was. But one of the things I brought out was that we've been so busy chasing the Medicaid dollars for this Medicaid transformation grant and this Medicaid transformation work that we've kind of drifted off of our course with the ACHs as to looking at the whole population. So we've kind of gravitated towards being the accountable Medicaid communities of health instead of the accountable communities of health. And ask the question, where do we go from here? What happens when that project is done? So what is the purpose of the ACHs? And we met with, last week, at the Washington County Association, WASAC. We got the small, rural, west side group together, administrators, to talk about that. So as the ACHs are moving down this course of the Medicaid population, how can we as the administrators of our small counties broaden that scope and start looking at the things that really kill us, the diabetes, obesity, smoking, the three biggies that we know really affect the health of the entire population, not just those who are on Medicaid. And we're pushing back pretty hard on the ACHs to at least spend some time and resources to allow public health to move upstream, because really the only way to reduce the cost curve on Medicaid is to keep people out of the system in the first place. Now there are some that resist that because by keeping people out of the system they don't get paid.
Yeah.
So it's kind of a double-edged sword. So we're treading gently down that road.
Was your presentation recorded?
Yes,
How do we?
Washington State Public Health Association. I'll send out a link to it.
Would you please?
Yeah.
I'd like to love to see it.
It was an interesting conversation, and then the conversations in the hallway afterwards were even more so.
I bet so.
So,
Like what?
Well, it's one of the ACHs. We were talking about social programs, and I've worked with this director from Better Health Together. I've been on several panels with her, and she quoted me to say, "The best social program is a job." And
Trying to get that girl killed, or what are you doing?
yeah, so that sparked a lot of conversation afterwards.
In that group.
So it's the whole public health arena is in flux. I mean, we've been kind of pushed into the Medicaid piece, and we're really starting to push back to say that's not our whole population. That is not, who public health serves. And we have kind of the definition problems with the managed care organizations. The insurance companies think public health is the population is whoever they have as covered lives. The population that comes through the hospital doors is the population for the hospital, and we look at, like Dr. You said, the whole population. So how do we integrate tribes? How do we integrate, all these other things, and the social determinants of housing and food and jobs and those sorts of things are definitely within the realm of what public health can influence. So we're looking to kind of refocus that. And what I would like to do is to maybe set some time aside in January to sit down with the board for a couple hours and spend some time looking at what Mason County can do as public health to start looking at some of those issues and kind of outline a plan for maybe even a work plan that we can address that would also pull in community development. Pull in the planning folks and have a discussion with planning and public health and with the Board of Health. Since we already have commissioners here who do planning and building work, bring some of our planners in to talk about public health as well.
Okay.
So, and how do you build a healthy community? Because that's really where we need to focus our efforts. We're unique in the state in that we have all those tools in the right toolbox, I think. So now it's time to start integrating and making sure everybody knows what the tools are. So I want to do that in January. I'll put some stuff out for the board. Okay, tomorrow I have another meeting with the steering committee for the $296 million ask. This is the first time that WASAC and DOH and WASAFA are in alignment on the ask, I think, ever. I've never seen it. All the stars aligned in this way. So we're going to push hard. What we're waiting on now is the governor to come out with his proposed budget, because we put this plan in August, resubmitted some details in September, and unlike last time, OFM has not come back with sheets and sheets of questions. So we don't know exactly what to make of that. That could be a good thing, meaning they understand it and they get it, or it could be bad things and it's not even going to make it on the plate. So I think it's going to be a good thing because we had OFM folks there at our meetings all summer long. So hopefully they were getting the education in the ugly process of what we were going through during the summer. So they have a better understanding and we're able to advise the governor. So we'll see what is on the table. As I'm the chair of WASAFA this year, and I've been counseled to ask for a smaller number than $296 million. But WASAC says, don't ask for the whole amount. A number of others have said, ask for the whole amount. And I don't intend to ask for anything less until the governor comes out with his budget, because I don't want to leave any money on the table. It's just not a risk I want to take. So we're going to wait for the governor to come out. So in our January meeting, which we moved up from the end of the month to January 3rd, for the steering committee to really dig into the governor's budget. And really, the governor's budget is there as a placeholder and generally gets chucked by about the second month of the legislature as the Senate and the House get in their own budget. But it gives us a place to start.
Sure.
So we'll be digging into that really hard the first part of January.
Dave, for what it's worth, when I go up to the Washington State Hospital Association meetings, they're seeing an opportunity for healthcare and hospitals to receive a bigger portion of that budget. So I think you're right on, spot on, when you go ahead and say, stay at that top level at this point in time,
Right.
rather than stepping
Why,
back down.
why negotiate from a lower position?
Yeah.
You know, so we're gonna start up there, and there's no reason that Wasalfo can't take a tougher position even than DOH, because we are independent. DOH is gonna have to toe the governor's line. We can come back and say, if the governor comes out and says 100 million, we're gonna say, no, we need it, you know, and we'll go to the legislature ourselves and advocate for a higher amount. So it's just gonna get very, very busy in the next 6 months. And that's where, because we're close, I may call on this board to come over and testify and to sign in or do whatever we can as these hearings take place, because we're close. We have
Sure.
the ability to have some influence. So they see me there all the time. I would like to start bringing my board in, because I can educate, I cannot advocate. So I can go ahead and tell them why things are good with the bill, why things are bad, you know, how it affects us. But I can't say you need to vote for. Can't go that direction. So but the board can. So
And I think they appreciate another elected official talking to them
right.
about an issue, rather than staff all the time.
Right. So that's kind of the direction I'm headed, is to keep the board as informed as you'll be starting getting a lot of material.
Good.
And then I'm going to ask for folks to help us out, because you're right, it does make a bigger difference.
Okay, one question.
Sure.
Have you notified our local officials, elected officials? Like,
Oh, yes.
they know? Okay. All right.
Yeah. In fact, I've not only our local ones, I've talked to.
I was say, have you met Dave Wyndham yet?
I've talked to all the East Side commissioners. I've talked to East Side representatives. I've talked to just anybody who will listen. I'm beating the drum.
Okay.
So we're out
Do you
there.
have champions yet in Ways and Means?
So committee assignments are being done this week? No, in 2 weeks on the House side. I think the Senate meets this week. And I'm waiting to hear what the committee assignments are. And then whoever that leadership is in those positions, their local health jurisdiction has been tasked to be the lead to push. So they're getting pressure from their own district, and then the rest of us will dogpile in afterwards. March 6th, we have Legislative Day on the Hill for Wasalfo, and I'll send out invitations to that as well. It's put on by the Washington State Public Health Association and sponsored by Wasalfo. We helped fund the Day on the Hill. I hope they have a larger venue, because we were packed to the rafters last year for the morning. So we go in the morning, and depending on your role, you're briefed on what you can and can't say. You know, as an elected official, you can do some things. As a staff person, you cannot. As just a community member, you have a whole spectrum of things you can do. So we tend to use the college students a lot, because they have a lot more freedom than staff does.
Terry should be available, you know.
Right.
I'd be happy to lobby.
Yeah. So
You'll lobby away.
we have hired 2 lobbyists. One to work with the foundational public health system work, and one to work with everything else, because it's not just the foundational piece. We also have things that are coming up around cigar lounges and all those other things that keep coming back year after year. So we'll be working those pieces as well. But the 2 pieces of legislation we're going to work hardest on is the ask, and then there's a companion bill that defines local public health as the primary partner with DOH, and we get concurrence with DOH before the money is spent. So it's the first time that local public health is at the table with DOH as a concurring partner. And
That's huge.
it's huge. It is
That
really
is
huge.
huge.
And in fact, if that language does not go forward, I am not comfortable with the whole ask. Because after this first year, if we get the money, DOH is not obligated to seek our advice on how that money is spent in any previous or any budget after that. So there's some dangers with how we've set this up, but I think there's some good things too. So we're going to be working really hard on the legislative piece in the first 2 months of the legislature. So that's when all the policy bills are going. We need to get that through. last year got through the House, stalled in the Senate. So I'll be working with primarily the Senate Rs to get them to understand what we're trying to do with this. And I think now that we have concurrence language in, the Senate Rs will probably be happier with the bill than it was last time. So we're also in that bill removing a lot of language that's just out of date. We had the Public Health Improvement Plan back in the late 2009-10 time period, I think. PHIP was out. And it's all out of date. The funding sources that fueled it are gone. So we're going to pull that language out and put this language back in and have a much shorter piece in the law that really defines the roles of WSAFL and Department of Health. So it's a good bill. So public health is essential. We're rolling both of those things under this big banner, public health is essential. The Public Health Roundtable is going to be in charge of the media work because they bring the Hospital Association and the Nurses Association and Heart and Lung and all these other groups belong to that roundtable. So our reach gets much larger if they run the media piece. So that's the direction we're heading with that. We came up with a video a couple of years ago. They'll probably update the video and update the materials, and we should be seeing something about the middle of December once we find out what the governor's budget looks like. What else is going on? Legislatively, that's kind of the biggies. Ledge Day. That's kind of it for those things. We do have a lot of construction going on. We'll have construction going on probably through the end of next summer. We should have our front door hopefully back into operation. They said by Christmas, but they're not going to finish the sidewalks and the stairs that connect to the front door until next spring. So, win some, lose some. We're making out okay. We do have issues with people with handicap access. We've lost our parking in the front of the building completely. Those four or five spots are gone. So our handicap parking will be on 6th for the upstairs, and then downstairs there's no change for the handicap parking for public health. So that'll remain the same. We talked last time about some of the new technologies we're working on. I'm working with Clark Halverson, who's the Assistant Secretary for Environmental Health, to actually come out and talk to us and go look at some of these small shoreline properties, because I'm not sure the DOH understands some of the issues we have with these really small, really old lots with on-site septic. So I hope to get him, the Assistant Secretary, and then his Chief of Staff for that piece to come out and actually work with us in Hoodsport and to actually get on the ground and walk some of these properties so they can see what we're dealing with. Going into the grant cycle again, and looking really, Lydia's got a couple she's working on. We're looking at replacement funds for some of our water quality work. If this $296 million goes through, there will be money available for us to do some water quality work and some assessments, so that's kind of a big deal. And I think that's about it for me. Any questions?
Thank you, Dave. Moving on, Alex?
I will be stepping in for Alex. I'm coding
Okay.
with Environmental Health. He had a planned day off, so he sent me here. I'll go over a couple of his things from the letter for October and November, and then he kind of wanted me to let me know what I do with kind of one of the different programs that Environmental Health would do. In October, one of the biggest things we did was Oyster Fest. All of the staff attended, all the staff participated in Oyster Fest. We did 39 temporary food inspections. No illness complaints that I know of, which is totally good.
Yes.
We had a booth set up that provided septic system information as well as water quality work. We actually ran out of septic stuff on the first day, so we had to come back and get it. So we gave out a lot of different things. It was good. We've been really busy doing various trainings, workshops, coordinator meetings. This is kind of our time where we go and get ideas from our different jurisdictions and our peers and work into what we're going to be doing in 2019. So we've been doing a lot of that, all of us in different areas. And unfortunately, one of our EH specialists, Sean McGuire, announced that he will be moving to a different jurisdiction. Today was his last day. I didn't say bye to him, I just realized. I know. He has over 2 years of water quality experience with us. He's one of our senior staff members, and his knowledge is gonna be missed, but I think we got a pretty good group that'll help fill in until his replacement gets there and then help train them in. So as far as what I do for environmental health, I've been there since August 2015. My main program is the food program, but like all of our environmental health specialists, we train in different programs and take over different ones from time to time and let them go as staff kind of rotates. As part of the food program, I do routine inspections, temporary inspections, reopening inspections, illness complaints, environmental health complaints, and illness investigations for all food establishments in Mason County. So keeps me pretty busy. One of the bigger projects besides that I've been working on is getting Mason County enrolled in the FDA Retail Food Program Standards. It's a 9 different standards that helps produce an efficient, science-based food program, and it's uniform throughout the country, so it's actually a really good program. I like it so far. It connects us to different jurisdictions throughout the country, and FDA as well allows us to access a website called Food Shield, where different jurisdictions can go and ask questions, have them answered, provide different educational material, and help each other complete these 9 different standards and better our food programs. So far, we've been awarded over $3,000 through the program standards for training and community outreach, and we have $1,600 pending right now for a training in January 2019. I should hear back either this week or next week on that one. Part of the money that we've got has gone towards community outreach, and one of the components of that is a Mason County Food Program page on Facebook, which is there to help not only give information to consumers, but also to retail food establishments and the industry alike. I picked Facebook because it's a good platform that a lot of different people can use, and doesn't really exclude people as far as like in face-to-face meetings. I kind of set the time limit, and thought it was pretty good. And there's recall information there, food safety strategies, the food inspection reports are posted there, which a lot of people have had trouble finding, so I thought that'd be easier to find. And our next grant cycle that's coming up for that is going to be in October 2019, and we're going to be asking for money to purchase tablets and other equipment to take our food inspection process digital, which should help save time and should also help make things a little bit more uniform. And that should work well, hopefully, with our SmartGov system that will be implemented soon. So yeah, that's what I do. If you have any questions on either anything that Alex provided or anything I do, I can answer.
How's the lettuce recall coming? Is it done?
I haven't heard anything.
You haven't heard?
They actually narrowed it down to California.
Okay.
But other than that, they have not narrowed it down to a particular, it's still out there, don't eat romaine.
Right. Just don't eat lettuce, huh?
Just romaine.
Just romaine.
I know.
I'm rediscovering iceberg.
Yeah.
I know, I was
And pie.
disappointed.
Pie is safe.
Yeah, I say.
Pumpkin pie, yes.
So with the board's indulgence, I'd like to bring some detail to one of the items that Alex put in his report. And he spoke about the rule revision that the Department of Health is doing around septic rules. My husband sits on that board that's looking at some updates, and there's some pretty significant things they're looking at, as they always do whenever they're looking at septic rule updates. But 3 I wanted to highlight for you were, right now, if you have a septic failure, it can be anything from a broken baffle to sewage on the ground. And so they're looking for an interim definition of septic failure. And looking at something called, septic failure or not operating at design capacity or capability or something like that. So that's a significant thing they're working on. Another is that they're looking at some changes in right now county governments or the local health jurisdictions do the certification of septic inspectors, and there's looking at some changes there that would have options besides just the county, cooperatives between counties, having some certification through some school certification that would be acknowledged. And so that's going to change a little bit. And then somewhat different, there's a really huge problem around the state that Mason County doesn't have, and that is that there are health jurisdictions that don't know how many septic systems and where they are in their county. I sat on a septic task force once that our largest county, King County, had no idea. They were so far behind in knowing how many septics were in there and where they were in their county. And so the Department of Health is trying to figure out how they can get control over this, which runs into the issue of it no longer being a local issue. And so there's this problem there. And one of the things they want to do is try to require a point of sale inspection of septics every time a house is sold, which the industry says we do it anyway. It's no big deal. So I don't know why that's required. But that's something else that's going on.
Banks are asking for it.
Only if you go
Yeah.
through a loan.
If you go through a loan.
Yeah, but I thought it was still required to have the inspection, not to have a pump, to have
Only
an
if it's
inspection.
only if
Only
it's
for a
required
loan.
by the lender.
Yeah.
Wow.
So just wanted to keep you up to date on that.
Thanks, Jared. Cody, going back to a comment you made about losing one of our staff members, do we know why he's leaving?
He is moving to Thurston County to work. He lives in Thurston County, so it's
Okay,
close to
so it's
home.
more of a less of a commute. then?
Yeah.
Okay,
Yep.
all right. Thank you. Any other comments or questions? Thank you, Cody. Good report.
Thank you.
Moving on to Lydia. Hi, Lydia.
Hey, so, I hope you liked all the data I gave you in
Yes.
Yes.
this report that my staff so diligently collects. It kind of gives you an idea of how large their jobs are. I only have 7 of them, and they do what I consider to be the work of about 20, like our other departments. But very proud of the data we're collecting that's beginning to show some trending and things which we're excited about. And at the end of my section, Allison's going to share some stuff about data and our new platform that we want you all to look at. I'm going to give you an assignment. But Dave reminded me, and I don't know why I forgot, but, and I didn't put it in the newsletter, but Abe and I were invited to speak also at the Washington State Public Health Association conference, and we had a session, a 90-minute session that was split with the Department of Health, and they wanted us to share about our opioid program that we've been running for the last few years, and it was exciting, and we had a lot of people from different jurisdictions coming up and have invited us to speak in different places around the state. So that was really nerve-wracking but fun. It was good. It went well. Abe did an excellent job. And then good news, so it's November, and we had hoped to be up and running in October, but we got our syringe exchange, our substance use mobile outreach up and running on November 2nd. And so it's been running for a few weeks now. It's operating twice a week at 4 different locations around the county. 2 are on tribal grounds, and 1 is out in Belfair, and 1 is just downtown here in Mason, in Shelton. So real excited about that. It's starting very slow, getting the word out. They have little cards that they give with the, did we bring any of those, Allison? We forgot them, didn't we? I forgot them. They have little cards that they hand out that have a phone number. We don't actually advertise the locations because we're not trying to draw everybody there. We're just trying to draw those who are interested, and so they're being shared at all of the syringe exchanges in the other counties, because that's where the Mason County people go right now. So it'll probably take a little time for them to recognize and feel comfortable with coming, but we've had some come already, and that's why Abe is not here and Christina, because they're out on Tuesdays and Thursdays. So they're out there right now up at, I think they're at the Goat Tribe right now, operating. What's really fun is our tribal, both of our tribal partners are participating, so they have people coming from their clinics to come out to reach out to the people that come, so we're real excited about that. And other partners in the entire county, and all of our treatment providers and our mental health providers, they're all meeting regularly once a month as part of our COPE project, and that's going really well. I was in on that meeting yesterday, and they're really streamlining the referral process, trying to solve gaps in services, trying to work with each other, discussing some of the problems that they're having with people getting into treatment. So it's exciting to see the collaboration that is going on in our community. It's really powerful, and they're all excited in the meetings. So excited about that. Allison's going to show you in a second some pictures so you can see what our mobile outreach looks like. So we can let you see that. And then we also have a short video. One of our we had one of the young ladies that is one of our works with one of the providers. Did a little interview, and she had some things to share, which I thought were great. And then I want to share, Stakeholder Meeting was mentioned by Dr. Yu. It happens every other month, so the next one will be in January. The last two have been out at Alderbrook. They've been awesome. We had close to 50 people this last one, well attended, all different disciplines and organizations across the county, and a lot of energy and discussing things that need to be done, and report outs from subgroups, because there's a lot of work groups that are going on, and this is the main group that meets together every other month. Been working on grants. We have had 4 grants in the last 2 months that we've written as a team. I'm exhausted. My team's exhausted. We've gotten 3 out of the 4, and the other one we'll hear about on Thursdays. So
Congratulations.
brought in a lot of money into the community to do a lot of pilot type projects and see what works. And collaboration also with other organizations. So this last one was in collaboration with the hospital and with Peninsula Community Health Services and Olympia's Capital Recovery and Dr. Grande out there. We worked together on this last one. So kind of excited to hear what happens. So I'll let Allison share a little bit. So this was our substance use mobile outreach. That's what the card looks like.
Can we get some cards to the
Yes, I was supposed to bring them, but I will run and get some.
Lydia, before I forget, this came up with the Community Voice. I was asked to step in because somebody canceled. This became quite an issue at the Community Voice, but it all went really well. In the end, everybody was.
Oh, so you mean talking about this?
Yes.
Oh, so that would be the first that we've heard.
So afterwards, they would like to request that we come and actually give them a presentation.
Oh, perfect.
But it actually they became supporters.
Great.
Very much so.
Awesome. When people are presented,
Except for
they
maybe
tend to
Bob
become
Harris, but we'll see.
supporters.
He quit fighting. Does that make
Thank
sense?
you for that
No, I
feedback.
think even he would.
And I don't know if you all heard, but Abe and Sheriff Salisbury were on the radio together last week, did an excellent
I heard 'em.
presentation.
They did a good job.
Really good presentation on this.
Actually, that's what started off the argument.
Ah, well, good. We're glad it got heard.
That's why they were upset and they brought it up because I didn't see it coming at all. But we had it went really well. It went really well because the reason why I switched over.
Education
they're all just
causes
like me.
people to
Yeah.
go, oh, now I understand it. So it's good. Well, awesome. Thank you for that feedback. I'll make sure I tell Abe.
So they're running it right now on Tuesdays and Thursdays at 4 different locations throughout the county. So we were kind of hitting north, south, and then the 2 tribes. So those are the locations, and you can call the number on the card to get a recording of the locations for people that.
And the reason why we did not put the locations on the cards is because we're still testing out how
Might be
locations
subject
are
to
working
change.
and how times work. We don't want to switch things on people, so we figured if they call a line with a recording, then they can always know what the up-to-date information is.
So
That's
here's
what
some
it looks like.
pictures of our RV that Dave helped us purchase, right?
What did it cost us in the end?
Less than 15.
Mhm.
Really?
It's a nice thing, and Dave's, because he knows so much about RVs, he was wonderful to bring. I said, I'm not buying this RV, you gotta come.
Yeah.
So, and we bought it down at Sundance, down the road.
Local? Good.
Local, yep. Told them what we needed, and they said, we think we have what you need.
And I'm sure they're very happy that they had that today when it started pouring.
Yes. Yeah, in the tent, right?
Yeah, we have a pull-out that isn't pulled out there, and then the tent for heat and weather, plus the tent has sides in case it starts raining really hard. We know eventually we'll have more and more people, especially since some of the providers are going to be signing up to come out as often as they can. And we're not going to have too many people at once because that can overwhelm people, but that way they can actually interview people, even assess them if they need to. So we want to have a nice, dry, and warm place. We have a little heater we can put out too. So yeah, and it's nice inside. I don't think they took any pictures of the inside. did they?
No, I don't think so.
But it's nice inside too.
So What's the contact information?
These flyers are being given out around the community, and different organizations are taking them and putting them up in their organizations.
Now, I know it's early, and you're not gonna really get a sample, but what are you finding so far?
We don't have enough yet to do that. There just isn't enough. So we're very anxious, and we are collecting some really great data there. So we will very quickly
Are
know.
people finding you though at all?
Yeah, they are. Starting. We'll continue during, we figured winter is gonna be a little difficult, as well as just starting up and learning about us. So they've gone and hit all of our surrounding syringe exchanges to give cards out, and most of the people that have either called or come have heard about it from the surrounding syringe exchanges. The providers now all know, so now they're handing out cards as well. As a matter of fact, we've gone through our first 1,000 cards already. So we know it's just going to be a matter of time. But we are collecting some great data, so we know we'll be able to track some things pretty nicely. Plus, I didn't mention our partners are all collecting data because of our COPE project that we're doing. And we're starting to get some really nice data back from that, and we'll share that in January, some of the data that we're collecting from that. So,
Did you want to do the video first?
yeah, could you? Is that okay?
Should be able to just click.
So this was videoed. I told my staff we are going to improve on background when you're doing a video.
Yeah.
But the video itself was excellent. And it was Mason, was it, who actually did it?
Diedrich.
Yes, Diedrich did it. Thank you.
Of
Diedrich
course,
did
who
it.
else do
I
we
was
have?
like, thank you.
Who else,
And-
Diedrich?
I recognize that logo.
And he did a great job. In every video he's ever done for us, he's fabulous.
He's a
But
blessing
I'm
to
gonna
this
make him put
community.
up plants and things in the back next
No.
time. Instead of seeing our messy room.
My name's Dave Gardner. I work for Mason County Community Services.
No, it's a big
Public Health, and I am the program
Can we turn it up?
for our opioid response plan.
It's on the laptop.
And I have with me
Cameron Hines, and
Thank you.
I work for Capital Recovery Center in Olympia, and I am also a person in recovery.
and we are both proud Mason County residents. So I'd like to start off, Cameron, by just asking you a bit about yourself. Would you mind telling us and our viewers and our audience a little bit about yourself?
Well, let's see. So I've been living in Shelton for a little over 3 years. I started my recovery process a little over 2 years ago. Had some bumps and hiccups along the way, but as of today, I have 8 months and 27 days.
Awesome.
So I'm
Congratulations.
pretty proud of that. About almost 2 years ago, my husband, myself, and my son were staying in the family shelter, and we were there for about 6 months. And still using off and on, probably, more than we should have, obviously. Right at the end of the 6 months, we got onto their housing program, found our house, and moved in. A few weeks later, I overdosed again, and this time I needed medical assistance and went to the hospital and spent some time there. And the next day I got a phone call from Abe, and you had just called and wanted to make sure that I was okay, if I needed anything, if there was any other services that I needed. And I would have to say, even though I had never met you at that time, something inside me told me that I could trust you. You were very encouraging, and one of the only people I think at that time that I felt I could trust in this community.
Appreciate you sharing. And I also want to thank your willingness to be open today and be vulnerable and share your story with the community. What are a few things that you would like to share with people that maybe have never experienced substance use or misuse or abuse, and as well as recovery?
well, first of all, I know for myself, like, I didn't wake up one day being like, I'm gonna be an addict. But at 18, I started feeling as though I didn't fit in anywhere, and so I wanted to fit in.
Yeah.
And so I would just want people to know that, yeah, it's probably dumb choices and, you know, not somewhere that we want to be, because it's not.
Yeah.
But when you first pick up that first drug or drink, it's not going through your mind that it's going to be something you're going to do the rest of your life. And so I think that there just needs to be more compassion for people, because I don't think I mean, I know for myself, I wanted to quit a long time ago, I just didn't know how.
Yeah.
I mean, what was once fun turned into something that was ruining my life, and I no longer had control over.
No, I think that you've answered that question beautifully, and I just, want to transition into, obviously I feel like the work you're doing is really giving people a second chance or a connection into some solutions, and you're really providing some hope through your job as well as through what you do in the community and being here right now. So is there a message of hope that you'd like to share with those that are still struggling, and or to families that have loved ones that are struggling?
I would just say, and I even told someone this the other day, like, this is a matter of life and death, and one day you're not going to wake up from it, and it's time to choose something different. As hard as that might be, it's just this time to choose something different, and you gotta let yourself trust, and there's gonna be somebody out there that cares for you and that's gonna be willing to help you and see you all the way through it. You know what I mean? I always hate when people say this, but if I can do it, if my family and I can do it, then I think that anyone can do it. I know the struggle, though. I'm not saying it's easy, because I came from the bottom and I'm working my way up. And another thing I would just say is just don't give up on what it is that you want, and don't let anybody tell you otherwise, because if I were to have done that, I don't think I would be where I'm at today. Nobody knows what you need or want more than you, and so don't give up on that, I guess is what I would say.
We have a goal here within this department, and in the community that I think we share, that we want to make sure that people know that there is hope, that recovery is a good thing. They're saying in the programs that we're only as sick as our secrets, right? And I think that goes not only in the individual level, but a community level. And so if we don't talk about these things, if people like you don't get in front of a camera and get vulnerable and share your experience, strength, and hope, it makes it more difficult for others. So I just want to thank you on behalf of Public Health, Mason County, and just on a personal level as well, for your willingness to be here with us today.
Yeah.
Thank you so much.
Thank you.
Awesome.
Awesome.
Gotta like that guy, don't you?
He did a good job.
That's the short version. There's a longer one too, but that's a short one. So I thought they did a good job trying to get some information out there. Allison's going to share now a little bit about the new platform that we've been testing out for our community health improvement, and just the entire community to be able to share data and progress, and people to be able to figure out how they can get involved. It's just starting, and so there's a lot more, but we want feedback from it. So we have a survey that we've created, and we've actually sent that out to the new coalition that's meeting up at Mason General Hospital, the Health Coalition. And then we're also going to send it out to all of you, if you wouldn't mind. It's not a long one, it's short, but if you can take a chance to look at this website to see if you think you'd get some of your questions answered, things that you see that are missing that could help us improve it. It's a way to look at how are we looking as a community health-wise, and we've only got a couple of things on here so far. We've got the opioid response and the housing, because those are the two that Mason County Public Health has been working diligently on for the last couple of years. But it has the opportunity to put on all kinds of things that the community is working on, so.
Yeah, so I put in your report, last time we brought you the community health assessment that we completed, and we felt like we needed a way to communicate that with the public in a way that was more interactive for them, a way that they could view it, you know, in a lot more digestible way than a huge document. So we decided we were gonna go with live stories to demonstrate that to people. So the way that it works is it's got different pages, and all of these images are hyperlinked, so you can click to go to a different page. So that's like different parts of the report that you saw last time.
It's still loading.
It's
probably.
So you can also navigate through the top pane as well. And I wanted to show you what's most important is these interactive graphs that we have. So people are able to hover over and see a certain percentage and see the year. If we're looking at graphs over time, we can also compare, different categories. So Mason County versus Washington State are different education levels. So it's a way for us to really communicate data to our community members that before they wouldn't have been able to see unless they read a report, which is hard for some people. So we wanted it to be more user-friendly for them. And like Lydia said, right now we have our assessment up here, and we also have pages related to our opioid response and our housing and homelessness projects that we're working on. So Tamara's video that I just showed you guys is located on this page. So people are able to view that. And then something I did this week was also integrate a calendar of events through Google Calendars into this, so people are able to visit the calendar at the bottom and see. This is a little overwhelming, but these are all of the AA and Narcotics Anonymous meetings that are happening in the county.
Good for you.
Next month. So just a way for people to go on and see that there are resources for you. There is hope, and these are all the different events that are happening, and here's how you can get hope. So. And then I'll show you a little bit of the housing and homelessness as well. Oh, and each one of these pages has a community resources page, so you can visit and know the different community resources that are available. So this is, for this particular one, this is our housing dashboard, and we wanted to focus on seven different measures that we measure in housing to measure progress. And right now we're on target with only 1 out of 7 of our measures. So just to give us an idea and to keep us accountable that, hey, we're not where we want to be, but with some targets, like down here, we're targeting to hit 20%. If we have that in mind, we can help ourselves get there, right? So just letting the community know about that.
And our partners, because all of this is actually done by the partners that we subcontract to.
Right. And then I'll just show you a quick resource page. So what's really cool about this is it allows you to list a resource, and then people can click and visit that resource's website directly. So if it will. So it'll take you directly to Community Lifeline's website, so you can get more information about their services and what they do. So yeah, Lydia, that's really all I had.
Questions? So we will be sending you all a survey with a few questions on it after you've looked at it, and if you could give us a little bit of feedback. We just really we're testing it. We want to kind of test it with the main leadership in the community first, and then it's live right now, and so we're going to be.
The survey we send you will have a link, so you can go directly to it.
But we have to kind of decide if we're going to keep this program in the next few weeks, because we only got it for 6 months to test it out and see if we liked it. One thing that I have to say, after working with Insight Vision for 4 years, this is very user-friendly. We like it because Allison just goes in and she puts it all in there very easily. All of the data, if we're getting data that's data from regular resources, it updates it automatically when new fresh data comes out. We don't have to go put it back in. So that makes it really nice to compare data. But we also have the opportunity to put in things on our local data that we're collecting, which we're real excited about, because with the opioid as an example, we have grants that we're tracking. We're really tracking data very carefully, and it's helping the providers know how to maybe change their work. If it's not working one way, maybe we change it a different way so that we can improve our data, and they're all working on that together. So
the commissioners might remember about, well, it's been some months ago, I presented Northeast Washington Trends, which is a website that we use, built and used up in Northeast Washington. Did some of this same kind of thing. It compared data across any number of metrics, economy, housing, all those things. It was put together by Eastern Washington University, and the cost to the community, as I recall, was like $80,000 to do that. This is something we can do ourselves, and what's our cost on it?
for the 6 months, it was 6,000.
Yeah, so it's about 15,000 a year. Something like that. It's about 15,000 a year to do this. So the expense is less. It's more timely because we're not waiting for grad students to put together stuff and give it to another grad student to put on a website. This was we got to looking at it. Lydia brought it to me in July or something, and Allison and I have been poking around. She's been doing all the work. I just poke around it. And I think it's better for Mason County because I think we can use this to draw in partners to add to it, where Northeast Washington Trends was just a product that was handed to us. Here you go. If you want something different, let us know and we'll charge you. We'll make the changes. I think this is a better platform, and certainly it's customizable and really much more up to date. And I love the fact that it draws data in on its own. So we're looking at how do we fund this. We may have to use some of our flexible funding to go with this, but thinking as partners come on board, they want to have a piece of it, you're going to have to pay a little bit to get into it. Your license, you'll have to pay for a license to be able to play. So.
But knowing that it didn't take her a big training course to learn it, and then she had it up and running, so it's very user-friendly, which was really nice.
So we can put schools on here.
Different agencies can have their own part of it, and
if you can use Facebook, you can use it.
Yeah. So
well, we know that's not true with you.
I really do feel, and I'll be making kind of a decision on the financing of it here shortly, but this is a better value than what I had seen before. It's probably the best value we've seen out there as far as getting data out that people can use. So
this is the dashboard that I was talking about. I've been waiting. See, I mean, it's all coming.
Yeah.
Now you're leaving.
And what we found,
stood up and now you're leaving, huh?
and what we found in Northeast Tribe was a lot of prospective businesses would call us and ask us, where's the data dashboard for your community? We would point them to Northeast Washington Trends. Well, we can get the EDC and Chambers of Commerce to point people to this. Because this, businesses coming in, this is very important information to them. What's the graduation rate? What's the poverty rate? Housing? All those sorts of things are very important and can help drive economic development as well.
Good. Good presentation. Appreciate that, Dave. Anything more, Lydia?
Any more what?
Anything more, Lydia?
No, I think that's good.
Okay. Other business and board discussion. I'm going to put Peggy on the spot. Peggy and I have had the pleasure of working with this group for a long time, and with Terry leaving,
We want to thank you
Oh.
for your
This is
work
your last
on,
meeting.
yeah, it's your last
What's
meeting
that?
here.
Oh.
And I know that you've been very involved with a lot of health things in this county,
Well, thank you.
including the behavioral health
Oh,
and
yeah.
the 0.1% and all of that. So I personally want to thank you for your work in health.
Thank you.
And I would echo that, Terry. When I think of the things you've accomplished, I think you should go out with a big smile on your face and say, yeah, you made a change in Mason County in the health, and how we've got this committee and this board at this point in time positioned to keep moving forward.
Mm.
So a lot of that is because of your leadership, and we thank you for it.
Mm. Thank you.
Yes, agreed.
Well, you don't pick the issue that comes to you that ends up being the one you work the most on. You'll probably find that out. I thought it was going to be all about something else. But I'm glad it picked me. Behavioral health is such a huge issue right now, and I don't know why. Just but
It is over the whole country.
or whatever.
Yeah.
But as a county commissioner, when we see how it interfaces with our criminal justice system, and then the people's feelings of feeling safe and everything, you just know it has roots and things that go so far out. And it's funny what you just said about how Facebook does the Facebook memories. Well, I had a memory come up from 4 years ago where I had been asked to evaluate some applications for monies in which the service for behavioral health services and all those services were going to be offered in Thurston County. And I said, by golly, we're going to have some here. And that's one of the things I'm very proud of, that we do have more availability here. And with that, I'm happy to say that we're pretty darn sure we're going to be able to open the Evaluation and Treatment Center by April. So
Good.
it's a lot longer than we thought, but
But at least it's coming.
And it'll be both short-term and long-term. That's the
Oh,
best part. We got
wow.
a second grant,
Wow.
so there'll be another 12 beds for long-term. So,
Great.
but carry on, folks. You're going to be great.
Any more business to come before the group at this point in
Could
time?
we set aside maybe 10 minutes next meeting and talk about wildfire and public health?
Sure.
It's a great issue right now down in California, but it's going to come back here, and we need to prepare for it.
We actually have a committee working on that.
There's a health officer committee also working on guidance for wildfire health advisories, and, when to close big events. I mean, if you have a
Right.
big event
Sure.
planned, and
Sure.
so this happened in a couple of other counties where they wanted to close the gorge, and there was a lot of pushback. Because it was a big financial outlay for some folks, but you really can't. There's the fire danger itself, but more than that, I think it was the issues of the smoke and the air
Yeah.
quality.
Yeah,
Long-term
that's
effects.
the main issue, really,
Yeah.
from a public health standpoint.
Yeah.
But
People know enough to stay away from the fire.
having
Yeah.
had some
Sometimes.
experience in it, I thought it might be good to toss around some of the things the board might be interested in doing.
So
So-
Dave, can you add that to our agenda for next time?
Yeah.
Good.
Boy, our agenda.
We can
is
get the
full.
health officers involved.
Yeah.
Well, they're working on there was some advisory put out, but they're working on it. I think the timing is about April when they're gonna come out with the document. It's more of a guidance document that they're gonna be putting together. And the health officers actually from East Central, the place where they have a lot of fires.
That's probably
Chelan,
Okanagan County,
Chelan, Okanagan, Wenatchee, that area.
Highway 97.
Yeah, that they're putting out. And Spokane, I think that they had a number of issues that came up last year. That's good.
Thanks, Gary, for bringing that up. Anything else come before the group at this point in time? If not,
Make a motion for adjournment.
Moved?
Second?
All in favor?
Aye.
Merry Christmas, everybody.
Yeah.
Thank you.